Okay, so what's the deal on estrogen? Just a quick summary because you're experienced about this a little bit, and that is, again, as we were talking about earlier, estrogen is elevated in women who are heavy. We think that elevated estrogen is associated with disease and death and complications. The common diseases that we know are increased by increased estrogen are blood clots and pulmonary embolus, breast cancer, endometrial cancer, and that right after surgery, those estrogen levels decline rapidly. In 3/4 of our patients, that's okay. It's no big deal. Your estrogen goes down and you feel good about it. But in 1/4 of our patients, there are other symptoms, like the symptoms of menopause, and they lead to anger and grumpiness and irritability, nausea, all kinds of different symptoms, and usually those symptoms pass in about a month. When we analyzed our patients and did a survey on this a couple of years ago, the average length of needing an estrogen patch was around a month. We had some people that used it for up to a year, and we had patients that used it for only a week, but the vast majority for a couple of weeks, some for 3 months, and a very small number, less than 5 or 10% as I recall, would go between 6 and 12 months. Because of the long-term risk of cancer, when we get up over 3 months, we like you to check in with a gynecologist to see whether or not it's appropriate to continue it. In general, most of our patients can come off of the estrogen patch somewhere between 1 and 3 months after the surgery. Another way to tell if you need to continue it is the patch lasts for about a week and tends to fade out towards the last day or so. So if your family is coming to you and a little bit sheepishly asking you if it's time to put on another patch, that's a hint that you need it and continue it. But if you don't notice towards the end that you need it, you might not need it anymore.
I guess what my question is I didn't use them for very long. I only used them for a few weeks in the beginning. And then like about 2 months out, I felt like I needed one, and I used one then, just one. And then I was fine, and then now, like I said, I'm 6 months out. And for the last couple months, I've been in a real slow loss, but this last week, I kind of had a big dip. And I don't know if it's maybe just the dip in the weight loss or something, but now I feel that same feeling like I did when I needed the patch before.
Sure, and again, if you think about it, any kind of, the classic example of this is the little girls who are gymnasts. The little girls who really exercise, the little gymnasts, they exercise so much that their estrogen goes so low, they stop having their menstrual cycle. Okay? So in other words, any stress can stop the menstrual cycle, or another way to say that, any stress can drop your estrogen. So if you've lost 90 pounds in 6 months and dropped a little bit more in the past couple of weeks or months, then that change could cause another drop in a stepwise fashion in the estrogen, and again, a short-term use is not unreasonable. There's no risk, essentially, or almost no risk, or very little risk, of a Climera estrogen patch at a low dose for 1 week. That's what we think. And especially when we've seen, really kind of emotional upset, we think that the risk-benefit ratio is such that we think it's a reasonable thing to take for short term. If you're going to do it for longer, we think you should discuss that with your doctor.
No, I just think I need it for just
Sure. We call it like a bridge, like a nicotine patch, to help you quit smoking. And if you think about it, the way I see, if you had to use a nicotine patch once or twice or for a couple of months, and then you were going along for another several months and you found it just for whatever reason you were kind of stressful and thinking about smoking again, using the patch again may be helpful. And that's true, we think, for the nicotine and also for the Climera. If you want to use it for longer term, though, I would consult with your gynecologist. But what we found is that a short-term use is really very effective. And also, if you put it on and you don't find any benefit, you can just take it off.